Okay, good. Good afternoon. This is the regular March meeting, March 19th of the Board of Health. The meeting is being audio and visually recorded. And as always, we start with public comment, which means comments from the public that have nothing to do with any item that is on tonight's agenda. Is there anyone who wishes to speak on that? Okay. I don't think I see anyone or hear anybody online, so we'll go on to number 3, which is the approval of minutes. Now, that's a situation, a minor situation that we have, which is that the minutes have not gotten into our packet, and the March 2nd minutes are not finished yet, and so we will approve those minutes in April. Which brings up number 4, and that's the director's updates.
Good afternoon, Rocky Miramontes, Public Health Director. HHS, the department, had the opportunity to provide updates on ongoing activities and priorities to the select board on March the 4th. I think that went well. We had lots of good questions and feedback that we were able to respond to. Measles cases in the United States, 1,362 as of a couple of days ago. That's just this year. There was about 1,100 last year, a little over 1,100. Most, 94% are associated with outbreaks, which we have not had in Massachusetts. There's only been 2 cases that have been diagnosed so far this year in Massachusetts, none on Nantucket. Really the only effective or the most effective prevention activity is immunization. ServSafe classes we're offering. It looks like we're going to have the opportunity to offer 2 this spring. As you may know, the ServSafe is a class that's required for restaurant operators that they have somebody on staff who is ServSafe certified. We have 1 class that is full, which is good because the more people we have with that certification, the better. So it looks like the second is going to be opened up. I would certainly recommend that for any Board of Health members to at least audit the class if they're available and would like that information provided to them. Community Needs Assessment, which is a human services project that was funded last year by the town. Happy to report that the number of respondents that have been received that gives the actual analysis that will follow the statistical power to make it relevant to the community. So that's good news. And we still have about a month or month and a half left to collect additional surveys that are being provided. If you have not had the opportunity, I would encourage you to reach out to the health department. We can certainly tell you where to find or show you where to find that information to provide survey data. And finally, Alpha-Gal, we just were notified, I think earlier today, that alpha-gal syndrome, which is the syndrome associated with the tick bite, primarily in the United States of the Lone Star tick, is now a reportable condition in Massachusetts, which is good news that it really enables the town of Nantucket to enumerate cases as they occur on the island. And I think I mentioned previously there's over 500 cases in last year in Martha's Vineyard. And that is not something we've experienced here. We've had about 10 last year. So now that it's reportable, I think we'll be able to get a much better handle on what the numbers are. And that's all I have, unless you have any questions.
Okay, Rock, thank you. Number 5, short-term rental regulations amendment proposal. We, I think, are going to open a public hearing, but there is an amendment, and helps to clarify short-term rental owner-operator requirements as defined in Nantucket bylaw, chapter 123. Would somebody like to read that proposed amendment, or do you
Would you like to open the public hearing first, or how would you?
think? Yeah, I mean, I think if we're going to consider an amendment, we need to do that. So, may I have a motion to open a public hearing?
A motion to open public hearing?
Yep.
Second.
All in favor?
Aye.
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 Okay.
And we have KP Law Devin Braun, I believe, is on now, who is available to. This was drafted by KP Law.
Okay.
Is available to summarize the contents of the amendment, which are in the packet, and also speak to I guess really the purpose as to why this was drafted, and how this language addresses the occurrence. So,
Okay.
Devin, are you on?
Yes. Hi, everyone. Can you hear me?
Yes, we can.
Okay, great. Thank you, members of the board, for having me here tonight. As you know, we're here to discuss this amendment to the board short-term rental regulations, by which the town has sought to address the proliferation of short-term rentals owned by corporate entities or investors that have no real connection to the health and safety concerns of sort of the residents and neighbors on the island. So under chapter 123-3H of the town code, there's a prohibition, as you all know, on short-term rentals in dwelling units owned by a corporation, among other entities who are primarily engaged in investment activity or pooling funds from investment activities. But the bylaw does, however, allow for certain LLCs, limited liability corporations, and S corporations to seek a short-term rental certificate, but that's only if every shareholder or member is a natural person. But so that's under the town code, but the town has been made aware of a potential loophole that exists for LLCs and S corporations who list their officers or business managers who are natural persons as the LLC's sole member or beneficiary. Despite having no residency or connection to the island, but purely for the, interested in the corporate entity's financial interest. So to more closely align with the town's policy goals, this amendment to the regulation would clarify that for those LLCs and S corporations, they would only be eligible to apply for their short-term rental certificate of registration if all of the members, partners, beneficiaries, shareholders, etc., are natural persons, and none of those people also serve as an officer or director of the corporation or the partnership or an investor in some capacity in that entity. So those applicants are going to bear the burden of proof of compliance in connection with your ordinary registration certificate process. They have to submit an affidavit signed by the authorized representative under the pains and penalties of perjury, and the Board of Health will retain its authority to require additional documentations and proof regarding the corporate entity's status. Current owners and operators also, will be given a sufficient amount of time prior to or subsequent to the effective date of the regulation to prove their compliance with this amendment. So that's a brief summary of this new section highlighted in the packet. And if the board has any questions or additional questions, I'm happy to answer.
Questions? Anybody?
Madam Chair, is this aligning this regulation with other regulations that the town has in terms of this kind of thing, or is this a refinement of the existing regulation? So are we aligning with other regulations, or is this a refinement just of this regulation?
Yes, it'll be aligning with the existing regulations on this. It'll be an additional section of your current regulations in section 338-4. It'll be a new subsection 7.
Okay, thank you.
Madam Chair.
Yeah.
Hi, Devin. It's Tom. Is
Hi,
this,
Tom.
I believe this will come to select board as well?
Yes, it is under existing town code, subject to approval by the select board prior to it becoming effective.
Got it. Thank you.
Anybody else? Any comments from the room on this amendment? Anybody have a hand up? No?
I have one.
All right.
Hi, this is Rebecca Duham.
Go ahead.
Okay, thank you. Yeah, I just had a question about the wording of this, and I certainly wholeheartedly support the intent to both make the amendment to implement the changes that the voters of Nantucket supported in the 2024 ATM and STM meetings to basically keep out of short-term rental ownership pure corporations that didn't have human beings behind them. And that might be too far removed from a connection to the island. So I'm really glad to see this is moving forward. Thank you for doing it. My question was, I think I understand the intent of the language, but one thing I found a little bit confusing is how the language in the new section 7 talks about these people that are natural human beings that are officers and members, and also have certain roles with regards to a short-term rental on Nantucket. It doesn't seem to be talking about the same short-term rental as in the registration being applied for. So I was just wondering about the use of the conjunction in this context where it says either owns or operates either directly or indirectly a short-term rental on Nantucket. So that was my only question and request for clarification, because I think the simpler and clearer this is, the better that we as a community have a chance of it being appropriately understood by the community and implemented and enforced. So any clarifications that can be done, I think, are beneficial. Thank you.
Anybody else?
Ms. Braun, do you have a response to that?
I was just going to ask the board if you would like a response or clarification, or if you wanted to however you prefer to proceed.
Yeah, go ahead and.
Yeah, the only thing I was going to point out was it's currently drafted sort of as broadly as possible, because there are, to my understanding, certain corporate entities that own multiple of these short-term rentals in Nantucket. So there are ways in which corporations can put an officer, create multiple different companies and put officers, for those companies, and it's essentially drafted broadly to say if you own or operate directly or indirectly a short-term rental in Nantucket, this prohibition will apply. But in my opinion, the board has, the opportunity to clarify further or make minor revisions.
No, Tom?
Good. Seeing no other comments, I would make a motion to close the public hearing.
Second.
All in favor?
Aye.
Aye.
I would make a motion to amend chapter 123 as presented in our packet. Excuse me, 338, correct, Revan?
Yes,
Yeah.
chapter 338.
They run together.
A second.
All in favor of making that amendment?
Aye.
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 Okay. Thank you.
thank you all. So I will be in touch with the health director to talk about the next steps to submit them for approval to the select board and publish them with the town clerk and the newspaper. But I just wanted to thank you all for your time tonight, and we'll be in touch. Thank you.
That's great, thanks. Number 6 is 42 Arkansas Avenue, a local upgrade approval request for a Title V septic system setback.
And I have you, okay there, Art.
Thank you. Madam Chair, would you like me to represent this or to defer to staff?
Through you, Madam Chair, it's up to you, Art. If I can speak for it, if you'd like me to.
Sure.
I
I'll-
think that would be good, John.
Yeah, so this is just a local upgrade approval for property line setbacks for the septic tank. This is one of the Arkansas Avenue lots, as I'm sure we're all very familiar with now. It seems like we're getting one of these at least one meeting per meeting. And since the lots are so skinny, you literally can't even fit a septic tank to meet the 10-foot property line setback. So they're coming in for that for local upgrade approval. And since it's local upgrade approval, it's not a variance that's issued by the board. It's just an approval. And the reason for coming to the meeting is to allow any neighbors to speak if they have any concerns regarding the situation. With that said, it's pretty unavoidable. I don't know how you could avoid it. So in short, no concerns, and it's an upgrade, so things are getting better.
Okay, can we go ahead and anyone? Okay, can we go ahead and
Make a motion to
Make-
accept the variance request for 44 Arkansas, the upgrade approval request for 44 Arkansas,
42.
42, excuse me. I'm moving them.
Second.
all in favor?
Aye.
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 All right, that's done for 42 Arkansas, and we go on to 66 Arkansas. That looks like exactly the same thing. Is that right, John?
Pretty much. This one, it's actually a little bit different. I think Mr. Bracken's online there.
Okay.
Go ahead, Mr. Bracken.
Can you hear me? Oh, here we go. Okay. Camera's not working again for some reason, but similar to the last project, it's a septic system upgrade. There's no new construction proposed on this project. The system is currently working. It just doesn't meet the groundwater separation, and it doesn't have an IEA in the system. So a little unique. We're on Hither Creek, but the system is as far as possible on the property from Hither Creek. We're a little further than what's existing there today. We're going to put in a microfast system and pump chamber and a drip disposal system, which is a shallow system close to grade to meet the groundwater setbacks, and also improves as much as we can the water quality using this type of system. With that, I'd be happy to answer any questions.
Anybody have any questions on this one? I think we can go ahead. Meredith?
Is there, so just the difference is that they can't meet the groundwater separation and
Right now, but the new plan proposes to be in compliance with that. Sorry, if you give me 1 second to check that. Sorry, I'm sure Don can confirm
Yeah,
on his plan that it's 5 feet.
It's 5 feet now. That's correct. It's all going to comply with the new system. The current system, I think, is 4 feet, something like that. It's a couple of feet lower. So there is going to be a slight mound in order to even accomplish it, even with the thin system that we're proposing.
thank you.
Anything else? Can we go ahead with that? With number 66?
Motion to accept the local upgrade approval for 66 Arkansas.
Second.
All in favor?
Aye.
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 Okay, that's approved for 66 Arkansas Avenue.
Oh, you
Now
know
we
what? I
have-
have to apologize. I was talking about 11 H Street. I'm sorry.
Oh,
But I think the same applies for 66 Arkansas. I didn't even realize that was going to be on the agenda. I thought it was just H Street. But, the same applies for 66 Arkansas, except that the description that I gave for the system applies for 11 H Street.
okay. Um,
That makes sense? Yeah.
should we make a motion again? I think we
Yeah.
should. Yes. Okay. Carrie, you want to?
Well, the motion to accept the local upgrade approval for 66 Arkansas, which was not, it isn't the groundwater separation, but an upgrade.
Second.
All in favor?
Aye.
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 Okay. Now we have a different thing. We have a septic loan request. And this is for 2 West Way.
That's correct. I can speak on it.
You want to
Like,
tell us about that, John?
sure. As you've been through the drill, this is not the property owner's primary residence as shown on the application. So for that fact, I recommend what the board has typically been doing in these situations for covering the 50% of the loan. This is for a technical failure, so lack of 6 feet of separation of groundwater for a conventional system in Nantucket Harbor watershed. So I'd recommend approval.
So he's putting in an IA system,
Correct. Yeah,
All right.
it's for an upgrade.
okay? And he is not a permanent resident. He's a seasonal or part-time resident.
Correct, as listed on the application.
Okay, so the approval then would be for a loan for 50% of the amount, correct?
That's been the standard practice of the board.
Okay.
Just a question of procedure. Do we specify the amount or just say 50% of the requested amount? They have the estimates here
Is
for
there
100,
less- Yes.
yeah, $114,455. So do we specify the 57,000, blah, 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 or just say 50%?
I think we usually do just 50%.
I
Am
think
I
we say
correct?
50%, but I mean, because I
But-
guess it
but-
could,
Costs rise.
Yeah.
And yeah, I wouldn't want to put a situation where we approved,
Right.
we thought was
right,
57, but it turns out to be 75,000 is 50% down the road after the work is done. So, just my concern just about that, just because prices have been rising, it's pretty much all materials and stuff, gravel and everything has just been going up. So,
I feel like we always say 50%. And so
okay.
for that, is that correct, John?
I don't recall, I'm sorry.
I feel like that's because there was one that we did where it was a new construction, but there was also another house that was there that they were replacing and we did like a third or two, I forget what we did, but we
Yeah.
did a percentage amount instead of a money amount.
Yeah.
I think it's only fair, really, to do 50% of what the eventual cost is when it,
Yeah.
all yeah.
Okay, I just wanted to clarify just because, numbers change and want to make sure that we're all on the same page about it.
Right.
So 50% is fine with me.
Okay,
Make a motion to approve the septic loan request for 2 West Way at 50%, not the non-resident price.
Second.
all right, all in favor? Aye.
Aye.
Okay, there you go. Loan approved for 2 West Way. Now we have 11 H Street. This is also for a septic loan request. It's also in the Nantucket Harbor watershed.
Correct.
John?
I can speak for that.
Yes.
Don did a good job already of, but I will say this is it's in technical failure. So less than 6 feet of separation for a conventional system in Nantucket Harbor watershed. I've also spoke with the property owner, she said that she's starting to have problems. So I'm assuming it's starting to go into hydraulic failure as well. So, and the application, she provided documentation that this is her primary residence. So I recommend approving the full loan.
Okay. So that would be for 100%.
Correct.
Any questions or concerns on this one? No? Motion?
Mo- Motion to approve 11 H Street septic loan request for,
Second?
Jim said second.
Oh, I'm sorry. I didn't hear you, Jim. Okay, all in favor?
Aye.
Aye.
Okay. 11 H Street has a loan for 100%. 113 Hummock Pond Road. A septic loan request. And this is for property located in the Hummock Pond watershed area.
Correct. Yeah.
Don?
This is also in technical failure, so lack of separation of groundwater. If you recall, they were in here, I believe, in August and September of last year. This is a bit of a tricky situation because there's kind of a perched water table on the property, and the engineers, the designers, proposing to get around that was to do a lot of remove and replace of material for the property, which ends up costing a lot more money. So that's why you'll see this loan request a little bit more than the ones that we typically see. They show that this is their primary address. So I'd recommend the full loan approval of the full loan amount. And I think Don's on the line if he wants to speak to it, but
Don, you want to add anything?
I'm all set, thank you. I think he said it perfectly.
Okay. So let's go ahead and make a motion to approve 113 Hummock Pond Road.
Madam Chair,
Yes, sir.
may I ask Mr. Bracken a question? Mr. Bracken, it's Tom Dixon. I just have a quick question about the cost on this compared to the other two. What makes this one a bit more? Is it the engineering costs or just, I'm totally fine, completely fine with approving it. Just curious from like an engineering standpoint, where the extra cost is.
Yeah, it's being like John said, the perch water table is within sort of a silty clay layer, and all that has to be removed down about 9 to 10 feet. And then new clean sand has to be trucked in to take its place so that it comes back to the previous grade. So anytime we see a system with a large amount of removal and replacement of material, it's much, much more expensive. I actually don't know I haven't seen the cost differences, but I'm sure it's significantly more or twice as much as a normal system.
Yeah, the loan estimate in the packet is $153,557 and 98 cents.
Yeah, that's probably twice as much as what you would normally expect.
Yeah.
Mhm.
Okay.
Yeah.
Thank you. And with that,
Yep.
I'd make a motion to approve.
Second.
All in favor?
Aye.
Aye.
All right, 113 Hummock Pond gets a loan. Now we have the environmental contamination report. Andrew, are you here?
I'm online. Hi, everyone. Andrew Shapiro, Environmental Contamination Administrator. Jericho, do you mind sharing my slides?
Of course.
Thank you. So I'll just get started while Jericho's doing that. I'm doing our typical monthly update, data update, and then I have two fact sheets. I'll breeze through one of the fact sheets and go through one of them in a little bit more detail. So on to slide 2. We have 10 new samples to report on this month. Most importantly, we have a new detect just above the state standard on Cato Lane. All of the other samples were non-detect for this reporting period. And of course, I've reached out to everyone who has received these sample results over the past month or so. Definitely hoping to see an uptick in sampling as the spring comes and the summer, where we had quite a bit of sampling last year. So hoping to see that soon. On to the next slide, you can see our map. So these new samples are reflected in this map. The Cato Lane one, of course, just off of Bartlett, is on the map, and the other ones are kind of scattered around the island. On the next slide, we have our data update. We already have a pretty large data set at this point, supplied by our Board of Health regulations, voluntary efforts of people in town, and Mass DEP's source investigation. As we add more data, this only updates incrementally. We're adding a relatively small number of samples compared to the existing body of the investigation and data drops. So no huge changes here this month. And that's the same for the next slide. The histogram should look very familiar. Again, no big changes to our distribution based on our most recent results. Next, I have two fact sheets. The first one is on health effects. This is largely summarizing the presentation from Dr. James Todd back in December. We had great speakers on the island, and we just want to incorporate their work into a fact sheet. So this will be up on our website soon. This is a final fact sheet. It overviews the health effects of PFAS. PFAS are known to affect most organ systems in the human body. And then if people are interested in blood testing, we have some information on interpreting results. So that's what's included in this fact sheet. And then Jericho, if you could skip to the top of the next fact sheet. This is our new gardening fact sheet. And this is new guidance. So I'll just take 2 or 3 minutes to go through it. We'll do some more communications on this in the next month or so. Jericho, a couple more scrolls, please.
I will shrink it a tiny bit. Is that legible to people? No.
That's a good zoom. That's good too.
Your eyes are better than mine.
And keep going. On to
Or-
page 9, probably. Yep, so this is our PFAS and home gardening fact sheet. Basically, we want to give people practical and sustainable tips with science behind them to avoid PFAS when possible. At the moment, we're not recommending or requiring PFAS sampling of irrigation wells or of soil. Basically, the way that PFAS can get from environment into your produce is complicated. It can also vary by fruit or vegetable, and there are no standards for PFAS in produce. Of course, less is better. But we do want to give some guidance. Some of it is basic and common sense, but it can be helpful. So one way that PFAS can get into your produce is from irrigation water. Again, we're not recommending or requiring testing, but if you do know that you have PFAS in your irrigation water, you can consider using a rain barrel to water your produce. Another way, and Jericho, on the next slide, please, there's these kind of helpful tips. Another way you can be exposed to PFAS is through direct contact with soil or dust if the soil is contaminated. So This is kind of basic hygiene, but making sure you wash your produce thoroughly. If there's PFAS in the soil, that will get rid of the PFAS that is in that soil. And same thing when you are gardening, wearing gloves can help you avoid exposure to PFAS, and washing your hands after gardening can also help you out. You know, the pathway from the soil to the water to the produce is a little bit uncertain, but if there's PFAS in the soil, you know you can wash it off if you wear gloves and wash your hands. Residents can also consider using raised beds with clean soil. So most commercial soil products are not routinely tested for PFAS, but products with biosolids tend to have lower PFAS levels than, products without biosolids tend to have lower PFAS levels than biosolid-based products. The town did used to sell a compost product with biosolids, but they don't anymore. So one of the key things to look for is this OMRI label. This is compost that is basically approved for USDA certified organic food production. And so that's going to be your best bet on avoiding compost or soil amendments that could potentially have biosolids. Last thing, limiting pesticide use. Some pesticides may contain PFAS. So if you are concerned about PFAS exposure, that is a potential way to go. Kind of talked about water sampling already. I'll talk a little bit more about soil sampling. Something we're not recommending at the moment. Soil can be a little bit more challenging to test than water. On the very last page, we do have a link from the state of Maine that has a little bit more detail on soil sampling for home gardens, both why it's a little bit more complicated and, you know, giving some tips that residents could potentially follow, but it is a little bit more challenging. And right off the bat, that main guidance says the best way to do soil characterization is to hire an environmental professional. So it is a little bit complicated, but we just want to have that resource here for people in case they are interested. We'll have some communication efforts on this fact sheet, but that's all I've got for now. Happy to take any questions.
Andrew, I have a question, and it refers to something that is early in this document, and
Sure.
I guess I hadn't focused on it before, but I believe it says that 98% of all Americans have PFAS in their blood. Did I read that right?
That's correct. It's
Yep.
basically everyone.
Okay. So if that is if that's correct, is the purpose of these efforts to prevent people from getting more than they already have?
Yes, less PFAS is better. That just simply less is more. And you know, 98% of people have some PFAS in their blood. There's 9% of the population that is really in that upper risk threshold. So if you're in that upper risk threshold, then you know it's more important to consider ways to avoid exposure.
Thank you.
Can I ask a question? Will you start, since it's an emerging topic that I know we've talked about, will we start looking at micro and nanoplastics in our water? I just read a really interesting article that said that people who had carotid artery plaques, they found that the people who had nanoplastics in their plaques had a risk, their risk of another heart attack, stroke, or death in the next 34 months was 60% higher. And I just thought, I know that they're finding testing to be able to test for that. Will we be doing any of that? Like, is that something we should start looking at?
I don't have anything planned at the moment, but I love the idea. The testing and the kind of action levels and standards aren't as far along as PFAS testing and standards, but it is something we need to be thinking about. So I appreciate the comment.
Hi, my name is Erin Myers. I just have a comment. So you're concerned about the dust in the soil, yet you want our kids to still play on the soil that has the PFAS on it. or sports. I'm just concerned about the hypocrisy here of the fields and the soil. You're telling us we know it's in the soil and the fields, but we're not concerned about that. Like it's wash your hands from, don't use your vegetables, the biosolids. But that's okay for our kids to play on. It's mind blowing to me right now that you just said all that, yet that's where you want our kids to still play. That's all.
Any other comments about Andrew's report?
It was great. Thank you.
Thank you.
Thank you, Andrew. Stick around, please. Okay, now we're going on to number 12, which is a board discussion of the turf field and determination of potential next steps. I'm going to do something that I rarely do, but tonight I'm going to read something that I prepared because we have so much to cover. We have so many strong feelings that I want to just make sure I don't skip anything or leave anything out. So this is what I'm going to say. Tonight we're taking up the proposed artificial turf field and track improvements at Vito Capizzo Stadium. I want to be very clear that that is what we are talking about, that and only that. The board has received substantial public comment and technical input on this issue, including prior open sessions of the board, reviewing various actions by other parts of town government, along with a very recent letter and recommendations submitted by the Nantucket Land and Water Council. During our prior proceedings, we've heard from members of the public about issues surrounding the safety of turf fields, the condition of the existing facilities, and risks and benefits of synthetic turf. Our task tonight is limited to this specific proposal at this specific location. We're not deciding broader artificial turf policy for Nantucket, and we are not addressing future installations anywhere else on the island at this time. The board has been asked to consider whether, if this project proceeds, it should do so subject to specific health protective conditions relating to product identification, PFAS testing, leaching analysis, storm controls, operations, maintenance, baseline sampling, etc. We will proceed as follows. First, we will hear from a school representative. Second, we will hear from the Nantucket Land and Water Council. Third, we will hear from members of the public, and then the board will deliberate and consider motions. I'd like to ask that public comment be directed to this proposal and to health-related and environmental-related issues relevant to this proposed installation. Once we hear from our invited speakers, we'll open the floor to the general public, at which time each speaker will be limited to 2 minutes, and the total public comment on this item will be limited to 30 minutes. We have asked the two invited interested parties to respect a 3-minute time restriction.
Can I just ask a question? I think I missed your first sentence. Did you say the track and the field, or did you just say the field?
Correct, the track and the field.
Because this agenda says a turf field on it. It doesn't mention the track?
Well, that might be correct, and perhaps that was an oversight.
But that's not how this works. The agendas have to be pretty specific. It doesn't say the stadium, it says a turf field. And you just said the track. So I'm just looking for a clarification because I hadn't really heard anyone talk about the track in the previous meetings either.
As I understand it, the project is known as the Vito Capizzo Stadium Project, and that includes the.
That's not what this agenda says though, ma'am. So I just want to make that
Thank
clear.
you for your comment. Um, is there somebody here to speak on behalf of the school?
I won't be long. Yeah. Travis Lombardi, Director of Athletics, Nantucket Public Schools. Dr. Hallett could not be here today. She's in a teacher contract negotiations meeting, so she asked me to read a statement on behalf of the schools. The Nantucket Public Schools appreciates the Board of Health's invitation to participate in the March 2nd special meeting and respects its responsibility to protect the health of our community, a responsibility we equally share for our students. The long-awaited renovation of Vito Capizzo Stadium, many years in the making, is essential to address the overuse of our current field and ensure safe, reliable access for students and the broader community. After extensive evaluation of financial, environmental, and program impacts, including lost student opportunities due to field downtime and the demands of maintaining natural grass, we have determined that a safe, carefully tested synthetic turf field along with an artificial track is the only viable option. Our student athletes are already familiar with and prefer turf surfaces. And with limited field space and growing program needs, natural grass alone is no longer sustainable. Independent expert reviews have consistently found minimal risk, and the project has strong community backing, including support from town administration and approval from the finance and capital committees. In closing, this is not just about athletics. It's about safety. It's about access. It's about opportunity. And most importantly, it's about our students. Thank you.
Thank you.
Okay, I'll keep my eyes open. Hi, everyone. My name is Willa Arsenal. I'm here today speaking on behalf of the Nantucket Land and Water Council. First, we want to thank the Board of Health for continuing this discussion and for the opportunity to speak again this afternoon. We recognize that our community has certain needs that we must try to fulfill to the best of our ability, and that includes investing in our students and athletes with adequate athletic facilities. Everyone here is also very aware of our need as an island to be mindful about how our projects and land uses impact the long-term health of our resources, especially the safety of our water. We have been working with our consultants at the Horsley Witten Group to review the information available to us and to provide this board and this community with an additional objective review of the data and science in order to facilitate this discussion and decision. Based on what's been provided to date, there are still important information gaps. There has not yet been a full evaluation of alternatives that would allow for a clear comparison of potential risks. The existing testing does not fully capture what may be in the materials, and there has been no testing to date showing what could leach out over time as materials age and break down. It is clear that the key issue in front of the board is not whether PFAS are present, but how much is acceptable. How can we answer the question whether the risk associated with this installation is acceptable when we have not been given enough information to know whether there is in fact a feasible alternative that would be safer? We all want to identify a path forward that fulfills our need for this facility while minimizing risk to the greatest extent possible. In the event that this project is to proceed with an artificial turf field, we have submitted an additional letter with a memo from Horsley Witten outlining what we believe to be important recommendations and requirements for the board to consider. It is essential to ensure that it is designed and managed in a way that minimizes potential risks to groundwater. This includes more robust material testing, evaluation of leaching potential, stormwater considerations, and ongoing monitoring over time. Gary Hedman from Horsley Witten is online to speak to technical considerations outlined in their memo, as well as existing uncertainties. Nantucket has a long history of taking proactive steps to protect its drinking water, and this is an important opportunity to continue that approach by making a decision that is careful and well-informed and protective of public health. Thank you. I'm happy to answer any questions.
Okay, thank you, both. We're now going to open it to public comment. Just to be clear, please keep in mind that the discussion this evening is limited to the proposed installation of the Vito Capizzo Stadium and track, and the conditions, if any, under which the board would allow this project to proceed. So I'd like to invite members of the public to come and speak. We'd like to put a limit of 2 minutes because we'd like as many people to be able to speak as possible. Try not to repeat what the person right before you has said.
Awesome.
I'm going to alternate between left, right, and online.
Okay.
So everyone.
Hi, my name's Graham Veazey. Since involving myself in this conversation, I hear people say all the time, I'm a grass person, and I get it. Grass is great in the right context. But when I took the time to understand what the school is actually dealing with, the level of use, the number of kids participating, the size of our campus, I realized this is not about a preference anymore. It's about what our kids need. If we don't consider turf, our kids' access to sports and activities is going to get cut. They will be faced with a tough decision, limit sports or limit play on the fields. Once I started looking into it, it became clear there are real benefits wrapped up in this project. So the context of what is being presented to you all matters. Outside advocacy organizations keep referencing studies about the risks of turf using crumb rubber. There is no crumb rubber in this project. And the NFL studies, let's try something relevant. Try comparing a consistent turf field to an overused grass field seeing 1,300 hours a year. That is our reality. And that would be like comparing a fresh Macintosh apple to one pulled out of the compost. Through no fault of the grounds crew, this is a usage issue. Context matters. So what are the alternatives you're saying are safer? Are we comfortable with the kids playing on the heavily fertilized PFAS-laden fields that do not have time to absorb those chemicals, with nitrogen running into our aquifer, with millions of gallons of water needed to maintain these fields? If we're going to talk about safety, then we need to talk about it consistently. So if the materials are the concern of this project, why are we only focusing on one surface that is non-detect? If that concern is why add more PFAS, then why is that standard not being applied consistently to all aspects of this project? Roofing and other building materials are known to contain PFAS at much higher levels. We're all looking at the same information. The school committee and the Nantucket Land and Water Council started in different places, and after reviewing the data, found a path forward with a precautionary approach. But I think it's fair to ask, if they are aligned after reviewing the same information, why isn't the Board of Health seeing it that way? And I think it's fair to ask what the legacy of this decision will be. Thank you for your time.
Okay. Hi, I'm Kim Latlip. So spring sports started this week. Our stadium should be in use. Do you know how many of our teams have practiced on it this week? 0. Not because it's not maintained and not because it hasn't been resting, but because it can't withstand the use our athletes need right now. So instead, multiple teams, boys and girls lacrosse, plus baseball, I think over 80 students are all sharing one field at NIS. Every day this week, one field. That's a lot of hard, fast-moving balls at a very small space. Did you see the image on the current of the track team practicing this week? They were training in the main hallway of the high school on tile floors where students walk in and out of the building, not a gym, not a track, a hallway. That is the current state of athletics in our high school. This isn't about preference, it's about capacity. We simply do not have enough playable space for our kids. Decisions made by this board have real immediate consequences, and we're seeing that play out right now on our fields. Thank you.
I have a Mr. Hedman online. Mr. Hedman, just note you're in the 2-minute time zone.
Go ahead.
Hi, good evening. thank you for having us this evening, and would like to commend the entire Nantucket community on the ongoing discussion. It's an important topic within the scope of our work with Nantucket Land and Water Council. We've been asked to look at a fairly narrow scope of considerations relative to PFAS concerns. I would first like to mention that several times this evening there's been mention of PFAS laden soil or PFAS in the soil. To my knowledge, we haven't been provided with any data that any testing of the actual soil of the athletic fields has been conducted. With regards to the recommendations that we made following the March 2nd meeting, we prepared a memo that Nantucket Land and Water Council provided to the Board of Health. And I think it's important to note that in the time since the March 2nd meeting, we've received responses from the applicant's project team, and those responses generally have echoed, or rather have signaled an agreement with the recommendations that we made in our earlier memos. So I think that some of the uncertainty is already being eliminated as to the performance standards that this project should be subject to, particularly with regard to the comprehensive and stringent testing of the materials. There has been some testing done to date, but there are also some materials that have not been tested. So therefore, we feel that it's entirely appropriate to make sure that all materials are tested so that the community does have the best available information to inform this ongoing discussion. I'll be here if there's any other questions in monitoring the meeting, but just would like to thank the board for their time this evening and again, commend the community on the ongoing discussion.
Okay, great. Thank you. Hi, good evening to all the members of the Board of Health. Thank you for your time. My name is Jenny Cook. I'm the mother of 4 student athletes in the Nantucket Public Schools and a local soccer coach. The Vito Capizzo project is not just about sports. It is about public health, safety, and the access for our entire community. Right now, our athletes play on fields that are unsafe due to drainage, overuse, and weather damage. Games are canceled, practices are displaced, injury risks increase, and opposing teams do not want to come play on injury-prone fields. That is the current reality of Nantucket's athletic fields. This project would provide safe, reliable space for physical activity, something we know that is critical for both physical and mental health, especially for our young people. Modern turf systems are PFAS-free, rigorously tested, recyclable, and safely used in communities just like ours with sole source aquifers. And this matters. There is a broad, real support across Nantucket. Parents, coaches, teachers, and the elected school committee have all done their due diligence, and they all agree these facilities are needed. So I respectfully ask, what is preventing the Board of Health from standing behind Nantucket's youth? Public health is not just about avoiding risk. It's also about providing safe, accessible places for all people to be active and to come together. With clear science and a broad community support, the choice is simple. Act to improve the safety and access, or accept the preventable harm. If public health is truly the priority of this board, then safe, accessible places to be active must be part of this decision. Thank you.
Is there someone online?
Is there anyone online who has oh, all right. I have Matthew Peel. Go ahead, Mr. Peel.
Can you guys hear me okay?
Yeah.
All right, thank you. So I keep hearing this, you know, how bad our fields are, and I don't know. in my opinion, I kind of feel like this is a very poor argument here because, you know, if they were able to stand up there and say, we've poured countless man hours and hundreds and thousands of dollars into these fields and we can't maintain them. We need grass or we need turf. I feel like that's a leg to stand on. And right now, you know, this argument that we've put in a limited amount of time into these fields and they're not playable is not a very good argument. So it just kind of baffles me there. And I don't think, you know, I kind of feel like the Board of Health could be saving this project from the people that are trying to push this turf field because, you know, our community is very smart. And essentially with the way things are going, what you're saying, and to put this in an analogy, is that you're telling the town that you want to go out and buy a car, but you can't test drive that car. You don't get to know anything about the car. Don't even know if it runs correctly, but you're going to get this car no matter what, or you have to take our word that it runs. And that's not going to pass at town meeting. So I definitely think there needs to be some testing done on these fields, but it needs to be done ahead of time. I think there's very poor execution from the school on this. This should have been, if they had all their ducks in a row and said, this is the testing, it's been done, here we go, then, you know, we have something to look at. There's nothing to look at. There's nothing here because they haven't done anything. They're just trying to slam this in here and sneak it into town meeting. It's not, our community is too smart for that. And so, thank you.
Thank you.
Great. Good evening. My name is Brent Tartamella. I'm here tonight because I believe the board is about to make a potential error in judgment, and we're all here to offer a better path forward. And if I may, to some of the comments that were possibly recently said, nothing is trying to be slammed in here. This has been a conversation for over 15 years, and I'd invite a one-on-one chat with that person. Anyway, I was a little thrown off in my comments to hear 98% of us have PFAS, and the turf has potentially less PFAS than our natural dirt. But I'll go back to my points. Part one, the science has moved on, and so should the fear. The turf fields being discussed today are not the fields of 2005. Modern systems use state-of-the-art infill with significantly reduced PFAS levels and self-contained stormwater management. And we have state-of-the-art testing that is standard practice. Nobody's trying to put something in and not test it. Banning turf based on outdated data is not protecting public health. It's really manufacturing and fear-mongering from it. Point two, mental health and safety is health. This is your purview as a Board of Health, right? I mean, it's pretty amazing that our student population participates in athletics at a rate of 73%, more than double the national average of 36%. And organized sport is one of the most evidence-based tools we have for adolescent mental health, social belonging, and resilience. If this board is serious about health, it cannot ignore what structured athletic programs do for the well-being of our kids. Point three, I've got one more, so bear with me, I'll be less than 2 minutes. We have a real health crisis, and the board's silent on it. Nantucket has one of the lowest ages of first drug and alcohol exposure in the country at 9 years old. Our wastewater data reflects the substances and the alarming levels of cocaine and other drugs. We live in a resort community where substance use is modeled, normalized, and largely unaddressed. There is no island-wide youth substance abuse education program. That is a crisis, right? Where is our urgency on education? And lastly, I just implore you to allow this to get to town meeting. Maybe that's what the last speaker and I maybe agree on. The school committee has spent 15 years working through the proper process, approving this athletic complex. It's been before, once and then twice. It went through public review, deliberation, a democratic vote. And for this board to circumvent that outcome through a unilateral ban driven by personal agendas is not governance. It's a shortcut around the community's voice.
Thank you very much, sir.
Thank you.
Over here.
Hi,
My name is Elizabeth Weber. Thank you for allowing us all the time to speak this evening. I would just like to, oh, I can lower it. Yeah, thanks. You've done this before. Yeah, you'd think I would have too. I am one of the varsity coaches at Nantucket High School, and I heard some concerns regarding the amount of effort that has previously gone into to maintaining our fields, and I'd just like to shed some light on that. I don't know how many of you are familiar with the struggles that the Nantucket Public School District faces from a staffing perspective and a housing perspective. Nantucket is not a known hub for professional field upkeep unless you work at my Comic Golf Course. We really just do not have those resources, and it has been difficult for us as a district to retain not only teachers but grounds crew. And we're not necessarily the number one place where if you've gone and you've studied this sort of thing, that's the first place you want to work. So that is a real and legitimate challenge that the facilities department is facing in terms of upkeep. Also, from a dollar perspective, they're limited within their budget of what they can do, as well as the man hours. These are things that have been discussed for a handful of months since November when I began listening to the conversation, and I believe even prior when the original plan was proposed. Testing hasn't occurred yet. I believe Weston and Sampson said that once the materials that would be used on our exact facilities, they would be tested once they got here. We can't test random materials because they need to be kept safe from contamination prior to installment. So I just want to be clear with the information that we're using. I've struggled throughout this entire process that the Board of Health has gotten expertise from a doctor, Dr. Bennett, who has no peer-reviewed research in this field. And what she has submitted for peer review has a sample size of 4. Thank you.
As a note, we have time for 3 more speakers, inclusive 1, 2, and 3.
He needs to speak.
Whatever.
So just so we're clear, that would be 1, 2, 3, and that would finish up the public comment for the time allotted. All right. Go ahead, Linda.
All right, I'm missing my Concom meeting because this is important. I've had probably more experience with that field, except for maybe Jimmy, than anybody in this room. I've had 8 kids go through that school, 6 of which have played on those fields, and almost all of those kids have taken sports camps during the summer. They played field hockey, they played softball, they played football, they played soccer in mud. And I've coached for over 40 years. It is time that we deal with these fields. They are dangerous when they get muddy. There are teams that moan and groan about having to come over here in the first place, and we don't have a first-class facility. But it is for safety, and it is not just football that plays on those fields. You have field hockey, you have soccer, you have all kinds of activities that go on those fields. You have field day in 8th grade. There's a lot of stuff that goes on those fields. And they do the best they can at that school to keep those fields up. But unlike the Delta fields, which I was involved with building, you were able to rotate the use of those fields so the grass can come back. You cannot rotate the use of those fields with grass. And it's about time that we did something for these students and we did something for the community, and it would also open itself up to other activities on those fields. But it is time to stop fooling around. And study after study after study, I agree with the last commenter that was here. I was on the school councils when this first came up, and I've been on CPC for 25 years, and we've been talking about that field since the beginning of CPC as to how the CPC could fund the recreational part of it. And because of other state issues, we can't fund turf fields. But we have been talking about it for decades.
10 seconds.
And we have got to get off the schneid, to use an old term. We can study it till the cows come home. They have submitted a tremendous amount of information. They have given you everything, and we keep going, moving the ball, like the Lucy thing. You just keep moving the football away from Charlie Brown. At some point,
you,
you
Linda.
got to let them kick the ball. And if you've got enough information and it's credible information and not something that's not
Thank
based
you,
on
Linda.
anecdotal, then we need to do something now and stop this.
I wanted to respond to the caller if I could, if that would be all right.
Madam Chair, we can end that at the end and you have 1, 2, 3.
That would be fine. That would be fine. He's gonna be at the end. Yeah.
Oh, that's fine. Yeah.
Go ahead, sir.
Yeah.
Thank you. Richard Brannigan. I appreciate the opportunity to say a few words here tonight. It's a very important decision that this committee is entertaining. It's impacting the community. It's going to impact the student athletes. And the consequences of your decision and what you rule is going to be pretty significant. If you rule adversely on this project and you rule against the project, I think you have to entertain and consider the unintended consequences throughout the island. What's going to happen to Nobadir? What's going to happen to the turf at golf courses? What's going to happen to the turf at the Boys and Girls Club on the playground that they just put in? What's going to happen to the turf that's on all of the playgrounds that are up and down the community on Old South Road? What's going to happen to the turf of homeowners who have turf in their backyards, whether that's a putting green or a driving range or turf for their grass? So I need you to consider the unintended consequences of an adverse ruling. And I know it's an important one, and I appreciate your time and consideration and the importance of this debate. Thank you.
Thank you. Aisha Khan. I am a co-founder of Nantucket PFAS Action Group and a mother of 2 children in the public school systems and also a taxpayer. And I'm trying to figure out and understand exactly what is being proposed in Article 12. The warrant says PFAS non-detected with EPA method 1633. However, through public discussions and publicly I've heard PFAS free, no intentionally added PFAS, no intentionally added long chain PFAS, no added PFAS present. These are all not the same. They have different meanings in science, regulation, and procurement, and they do not confirm the absence of PFAS. This isn't theoretical. In working with the firefighter associations, in working with the Professional Firefighters of Massachusetts and the International Association of Firefighters, which are 1.2 million firefighters across the United States, I've worked with them closely to understand these terms, to figure out what is in AFFF foam, to figure out what is in the turnout gear, and phrases like PFAS free or meets California Proc 65 or meets state regulations have always been told to us. And it's also a little bit of legal wordplay where you have to kind of figure out what it means. And what we think it means isn't always what it means. We've also seen real consequences. In Quincy, firefighters were issued gear that they believed were PFAS free, but later the tests were showing that PFAS was present, and now they are dealing with the aftermath of that and what they have to do. So clarifying and clarity does matter before public funds are committed. This raises a question. Have alternatives been looked into, including GRASS, including nonprofits, including perhaps the Land Bank, Remain, all of these other nonprofits? Could we come together? I know that that's a bit of a different topic, but have we fully looked into it? We are a community that helps one another, and I wonder if we fully looked into all of those. Also, have we fully addressed, that would also possibly, and I actually think it would address the usage issue. What happens if
10
the turf
seconds.
does not? Oh, okay. I also have broader concerns, but I'll leave that. Protecting public health means addressing risk before harm occurs and applying a precautionary approach when there is uncertainty. And that's the role of the Board of Health. I believe that there is an opportunity to do that tonight. Thank you.
Just for the record, the public comment section is now completed. We're having one response back to a particular point made by another commenter.
Chip Clooney, Director of Facilities.
With regards to the grass field and the turf field, I think what's being missed here is when we have grass fields, we have set up for two sports, lacrosse and football. The wear and tear on those fields at those points, at the goal mouths and in the center of the field with grass, cannot be maintained. The grass is not growing yet, but the kids are out there. They've got cleats on. I don't know if anybody's been to a lacrosse game, but face-off in lacrosse is two boys, two athletic 18-year-old kids, face to face, down on the ground, twisting and turning their feet and with their power coming from their legs. This tears up the grass. It can't help but do anything but it. That is why all these schools around us, all the schools that we play to, have gone to turf. It's our climate. It's where we live. We have a grounds crew that works very hard, does everything they can to make these fields as playable as possible. I've gone back on Google Maps and we've looked at the fields. There's a stripe down that field you go back to 1995. It hasn't changed. We need to change. We need the turf. We're doing everything we can to make the place safe, but we need your help and we need this project to go through. Thank you.
Okay. Thank you, everyone. Public comment on this agenda item is now closed. The board will deliberate. I want to say something before we go forward. I'm going to make a motion because I believe there is a compromise position.
I also have a motion, so
That's
can the
fine,
board hear
Meredith.
both?
Yeah,
Madam
but
Chair, I have to do this. I have a point of order.
yes, Tom.
So I emailed the memos that were sent around today.
I'm going to address that, Tom.
So, but we can't vote on anything. So you shouldn't make a motion because we'd be violating open meeting law if you
That
did.
is not what they replied to me.
Jericho, Rocky, and John have received this email. We have been advised that we should not do this. We should also disclose these emails to be safe. So
I believe
I will not sit and do any motions for this.
Let me tell you what has happened. Around 2 o'clock this afternoon, I emailed the board the the two motions that I intended to make. Now, we all know that under open meeting law, there is no, the board cannot deliberate with each other, cannot talk about things with each other and all that. However, on page 7 and 8 of the Guide to Open Meeting Law, it talks about when there is material that the board is going to be asked to deliberate on, and the ability for the chair to send that out ahead of time, for the board to be able to look at it, as long as the board does not discuss it. When I sent that out, I sent it out with the following comment. Please do not reply. Please do not discuss with each other. Please do not share with anyone else. I got an email from the compliance officer about my having done this. And shortly before this meeting began, I got an email from the town council. And as I understand the email that I got then, it said that as long as I disclosed that I had sent this out at 2 o'clock and that there was no discussion, that I had essentially been open with exactly what was done. So I felt, if you'd like to see that, Tom, I'm happy to show you the email from the town council.
I was copied on that email, so I've seen it. And it also, this is a confidential legal memo, as is all communications with town council. So I don't want to go into too much of the details, and this is a little bit off topic, but given that the agenda item was so vague and there's nothing in the packet, there is not, like some of the commenters tonight said, well, we want this project to go forward and what you're considering. Well, I don't know what we're considering. I never have known. Are we consider, no, please, 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 thank you, but we don't want to do that. We are a public body. We are required to put things out there before we do it. The opinion goes on further to say that, and there's also an attorney general opinion on it, that by my reading of it, that we shouldn't, that this shouldn't go on like this. So I suggest that we hold this until another meeting when this is in the packet and the public has had a chance to digest it, and then come back and then we can talk about it.
Madam Chair, I have a hand up from Don Hill Holgate.
Yeah, go ahead, please.
Hi. I was also copied on the email, and I would respectfully agree with Tom Dixon that I would err on the side of caution here, make all of the emails public and continue this hearing to a later date before you move forward with any motions. And I would also request that you please have Town Council, Janelle Austin specifically, present for the next hearing.
Can I ask a question? So I guess what I would like to do is add some testing to the warrant. I think that is different than what you're thinking we're doing, because the testing that is currently in the warrant is one test for 40 PFAS, and that is it. There's no other testing. I think people are under an understanding that this has been tested widely. 2 parts. We've been given marketing material that shows 2 parts of the turf system. There's a lot more to that. 2 parts have been tested for just 2 tests each. And I know some of you were involved. I was involved in this in 2021 and 22, and we had about almost 50 tests to review. And I think as a community, doing our due diligence would be adding the testing. We can discuss this in April, but I believe that if we want to add testing to the article, which it says that we are allowed to, that we need to do it by the end of the month. So I have a list of all of the testing that should be done on the proposed turf carpet, backing, infill, shock pad, the running track, and the track underlayment. And I have tests 4 different, so there would be 4 samples, and I have a list of all of the tests, because what everyone has been saying, and I think that we all agree as community members, we want the safest products, and we want things to be tested to make sure that we're not exposing our families to certain chemicals that we may or may not know and currently don't know are in there. And I think that our due diligence as a community would be to require that this testing be done. And I believe in the article we are allowed, it says that other committees and boards can add things, and that is us. So I guess I would respectfully ask that we can add this testing so that we're protecting the taxpayers from lawsuits.
Madam Chair, just as a point of order, the previous presentations that were made by the school outlined a wide array of additional testing that would be configured into the contract or the bid for this.
That's not what's in the article.
I cannot speak specifically to that, but the discussions of the testing regimes were pretty extensively covered in the previous presentation. And to my understanding, the binding document between the contractor and the receiver is the bid document. The article authorizes funding and puts parameters around it.
It does,
Madam Chair, point of order.
Yes.
This topic is not agended. It is not noticed properly. Town Council has weighed in on it. You are, in my understanding, I also, as a select board member, we all received the memo from Town Council today that both Mr. Dixon and Ms. Hill have referred to. You are in very, very gray area here on open meeting law. My job as a select board member, part of my job as a select board member, is to protect Nantucket from being accused of violating open meeting law. That is our role. I think you're very, very, very in muddy territory here. And I would reiterate what both Tom and Dawn have said, that this should not be continued and that a very specific agenda listing the topics to be discussed, including amending warrant articles, none of that's agended. The public had no notice that what you've discussed or what Ms. Leprey's proposing right now was going to happen at that meeting. And that is the purpose of open meeting law, so the public can be prepared to come and speak to the items that will be discussed by the board. I'm very concerned, and I hope you'll hear me out. Thank you.
Well, I feel that given what has transpired, that we need to delay until April and have a clearer agenda item that discusses exactly what will be discussed in terms of.
Madam Chair, I would respectfully request that we have a meeting before the end of March, because that is when the town, and maybe Tom or Brooke can comment, or if Dawn is still on, I believe that if we want to add testing, that it needs to be added. And it says just one test, and it is just one test that tests for 40 PFAS. It does not test for anything else. I do think if we're doing our due diligence, we should be adding that, but maybe Dawn can comment.
I guess I need to know before we decide on that point about what Jericho was saying. It was my understanding that it would be the bid document that would be the important thing, that the warrant article only mentions a minimum standard, but that the bid document could be far more stringent and strict.
Madam Chair, I really don't enjoy this, but we are now having a back and forth on an unagended item. We are in, as Brooke said, very serious gray area on open meeting law. We should not be having this discussion. So I suggest we move along.
I think
Well, it says, I'm sorry, it says board discussion on scientific presentations regarding turf field and determination of potential next steps. So in that realm, I will happily say that I was very concerned about the risks of injury, because on the presentation that Dr. Sarah Evans made, she pointed out that a lot of the articles that discuss turf being safer were presented by were paid for by the turf companies. I thought it was very interesting to learn about the comments about the micro and nanoplastics. I thought it was super interesting that 20,000.
Mary,
Is this not
I
part
think
of-
we need to, yes, I think we need to dismiss this now. And I think we need to, hello? Is someone with their hand up?
There's two hands.
Mike, you're muted.
I didn't know I was being recognized yet. Okay, so I'm looking, and this is just for the record, Mike Hugo, Director of Strategy and Government Relations for the Mass Association of Health Boards, and I'm not here to give any legal advice.
Madam Chair, point of order. I'm not sure why the speaker is being recognized when the topic on the table is whether to close this meeting. There's a process
don't
question.
clap.
There's a process question on the table right now. My recommendation as a former chair is that you move from this topic, as you've said, and schedule it for reschedule it with an agenda that displays what the detail. A vague agenda item leaves room for anything to be discussed. It is the opposite of the purpose of open meeting law. Open meeting law is meant to both notify the public of what's going to be discussed and frame what is going to be discussed so that people can anticipate that in advance, not a free-for-all on any topic that anyone brings up. Thank you.
I think we should make a motion to close the further discussion on this subject tonight. And I,
Yeah.
Okay. and I think we
think
need
you
to
just move.
find another date.
I think you just go to item 13. There's, you can just move along. Reschedule it for April.
So we make, so that's one thing. So in terms of scheduling, you know, do we want to hold a meeting just totally dedicated just to this issue before our next regular meeting in a month? Just because, you know, we have interest of the town. There's a lot of issues that are, I think, very legitimate on both sides. And we do want to make sure that when we operate, we are operating within a non-contested environment. So, you know, yes, we should move on, but do we want to consider having a special meeting before our next annual meeting? Or not annual, but next month meeting?
It would be all right with me. Meredith, I know you'd like to. Jim, what about you? Yeah,
So is that something we can ask the Rocky and his crew to kind of help us pull together a meeting? We'll meet the appropriate meeting notices. And also that we really do work with town council to set up an agenda that kind of covers. It's going to be somewhat broad ranging because we have a lot of issues, but you have to itemize them so that everyone knows what is going to happen, what's going to be discussed, and it allows us then to actually make motions to do something. Right now, we're kind of frozen. So
correct. Yep. All right,
We can examine the schedule as it's coming up and
right.
see each other.
Let's say that we will try to schedule this meeting as soon as is practical and possible. Okay. Thank you, everyone. Okay, this is a continuation public hearing of Hammock Pond watershed regulation, new changes to the regulations for Hammock Pond, and I'm going to take it up with 14 as well because it also includes the wellhead protection district. As everyone knows, I think we had a meeting with a joint meeting with select board, planning board, housing board, and we kind of talked about the new regulations, and I think that the board can chime in here, but I think that the decision was that our staffs of all these different organizations would work together. There were 4 points that the select board put forth that the other organizations seem to go along with largely, and the staffs were going to work to kind of integrate them into the new regulations. Anybody want to make a comment on that? Rocky, looks like you want to say something.
Yes, Madam Chair. It's I think from the health department's perspective, we were always more than willing to help with the drafting. I think what we need now is actual edits as opposed to comments. So what should we write in there to then be able to take that to town council for examination? So whoever the board would like to be involved, I know there was some discussion at that last meeting as to potentially who, but if you will give us some guidance, we're happy to reach out. And I know Carrie has been involved in the drafting, but if that's housing or who exactly that is, we're happy to try and make those connections. But before we do that, we just want to make it clear that at this point we need edits, not comments.
Can I ask a question? I thought that meeting was very interesting. It was interesting to hear everyone's thoughts. I wonder, I guess I'm just cautious in that all of those 4 points, I don't want us boxing ourselves in. And I worry that we allow a lot of the variance, like people can come to us for a variance anyway. We had said that we were open to hardship variances, and I don't know, Tom, if you have a a comment on this as far as the housing side of things. I just worry that, are we gonna be too specific that we're going to be shooting ourselves in the foot, so to speak? And maybe not. I mean, that's, the housing side of things is not my specialty, obviously. So that's,
Yeah, I don't know what shooting ourselves in the foot means, but I think all that needs to happen is either staff or we delegate a board member to meet with housing staff and talk about it. I think that's it. That's all that needs to happen. And then we come back with some suggested language, we talk about it, and we either incorporate that or not. That's it.
Yeah, I mean, I think, I think we're very, very close. And our discussions have always, we've said we are willing to work with, but we need to know what we're working with. And I think the 4 points, some of those are things that we really can't, I mean, increasing loan programs and stuff is somewhat, we can suggest we'd like to see it, but we can't mandate it. But there are things we can do in terms of working with the affordable housing folks, and that's across all the agencies, not just one, and about some wording that would be, it would provide guidance as to what kind of variances would be, they know what they're looking for. And then a question I had, I mean, I didn't ask it before until now. When you have a regulation like that, does the regulation have to contain all the information, or can there be appendix that provides details? And that appendix can be updated as situations evolve. So how much has to be physically in the regulation? And is there an appendix that can define, are we allowed to have an appendix that might define those conditions of the types of variances we would pay more attention to because they are addressing housing needs? So one's a structural thing about how regulation and if amendments work, and the other is, I think we can do this. So, it's doable, but the regulation right now is pretty straightforward. The housing stuff is what we're trying to tweak it in, and do we throw it into the regulation, or do we throw it as an amendment, as an appendix that defines these are areas where we will, have special consideration? And that's a question that's way outside of my head.
Okay,
Yeah.
I'm gonna take a stab at a, I don't know, an offer or a whatever. Why don't you delegate me to work with housing staff, and we'll come up with something, and it'll be submitted to staff, and then you can discuss it at the agenda meeting on whether to put it in the packet for April. Because I understand where the board's coming from. I understand when housing's coming from. It doesn't have to be me, but like I understand this issue after being on the trust. and
It
all
could
that.
be both of us, because
I don't think so. I think we'd actually have to do a subcommittee and need to be posted if we did that. So
well, Carrie, you're the one that's been working on this,
That
correct?
would-
well, I've
Yeah.
been working on it,
Who's
but
the one
Tom,
that
but also,
drafts the
I
regulations?
respect that Tom has an experience base that's much broader than I do. He's worked
I
on
wonder if
housing,
it
and,
could be
so
both of you.
that's why I was asking. I mean, it allowed me to learn something.
I
too.
wonder if it should be both of you. I mean, I think
If
it's
that's
pretty
doable.
clear that the idea of just saying we allow variances, what that's gonna do is put us right back to where we were in June or whatever it was, that just anybody could come for a variance. So we have to, I do think it's very important that the variances or the circumstances in which a variance could be considered are
Or somewhere.
are
Well, they're in somewhere, yeah, they're clear, and they're in a legal place that's clear.
right.
I want it to be, don't want to do run a regulation, and we find out that we have something running on the outside that we shouldn't. And so I just want to make sure that what we end up, if it has to be if the language has to be in the regulation, it'll be in the regulation. But my question was really, can an appendix be added to the regulation, which provides those specifications, and those can evolve over time if necessary.
If it's a regulation, it's a regulation. If you're gonna have, you can't have a regulation if you're gonna let someone have a house in there. If you do that, if you make an exception, it's not regulation. Either it's a regulation or it's not a regulation. What is it gonna be?
that is really, the structure it
It's
so that,
either have a regulation or it's not a regulation.
All right, I'd
If
like
you
to
make an
propose-
exception, it's not a regulation.
How about, because I think that, Tom is conversant with what the housing people are looking for, and Carrie is very conversant in why and how these amendments were made. Could we ask the two of them to be our representatives?
Madam Chair, just as a point of order, if it is 2 members, then they'll have to be declared and posted as meetings, and that would limit the availability and what can be discussed in the meetings. And I think, Tom, correct me if I'm wrong here, it would also require minutes collection, et cetera, et cetera.
it's a subcommittee type thing.
I thought it would be, as long as it's less than,
No, because we'd be deliberating on potential regulations. We can't do that. You can't have 2 members deliberate. Yes, a quorum, meaning 3 of 5
Yeah.
is an open meeting law, but you still can't, I can't call you and say, hey, what do you think about this agenda? That's not a thing. So, yeah, I think it should just be Carrie. Maybe you can meet with Dylan
Yeah, I'm gladly.
and come up with them.
yeah. Yeah, I think that's good. All right. All right, Carrie, you're willing to serve in that capacity?
I will contact Dylan tomorrow morning,
All right,
plan to get together.
okay.
Now to do this.
Madam Chair, I have Dylan raising his hand.
Oh, yeah. Hi, Dylan.
Dylan, let me just give you the allow to talk. You should be good.
Hi, everyone. Dylan Metcalf, Town's Deputy Housing Director. I just wanted to say thanks, and Carrie, I'm happy to work on this and look forward to connecting with you on this and to the collaboration.
Okay, no, thanks. I'll give you a contact your office tomorrow morning to set something up.
Sounds great.
Great, thank you.
All right. Is there any other business? Anything else that anybody needs to bring up? Because if not, I think we can adjourn.
Don't have to
I have a motion.
Okay, stay here.
Should we try to find a date for that meeting before we adjourn? Okay. Okay. Fine. Okay.
Okay.
I have a motion.
Make
to
a
adjourn.
motion to adjourn the meeting?
Second.
Okay. All in favor?
Aye.
Aye.